Senior men, surprising prostate effects. Life after 60. Today, the untold truth about daily masturbation and your prostate health revealed. Through real stories at 45, John started noticing something strange during his usual morning routine. At first, it was just a subtle feeling, an odd pressure, an unusual sensation when using the bathroom. Nothing too alarming, nothing that seemed urgent, just a whisper from his body that something wasn't quite right. But like so many men, John did what most of us would do. He shrugged it off, convinced it was just age stress or something he ate. He had no idea his prostate was already sending him warning signs. And what happened next? It changed everything he thought he knew about his body. The prostate, a small gland with a huge impact on men's health. The prostate is about the size of a walnut. It sits quietly beneath the bladder, surrounding the urethra, often going unnoticed until something goes wrong. But here's what most men don't realize. This tiny gland plays a far bigger role in your daily health, vitality, and long-term comfort than you might imagine. It's responsible for producing the fluid that protects and energizes sperm. It supports hormone balance, and it influences everything from your urinary flow to your sexual performance. But without proper care, this sensitive gland can become inflamed, congested, or even permanently damaged. The silent danger. Everyday habits you think are normal might be causing harm. We grow up believing that if we eat well, exercise occasionally, and don't overdo it, our bodies will take care of themselves. But sometimes the very habits we consider harmless, or the ones we avoid due to shame or misinformation, can silently work against us. And that's especially true when it comes to how often or how little we engage in self-stimulation. In this video 3, surprising changes that happen to your prostate when you masturbate daily. These are insights backed by clinical experience, patient stories, and a growing body of research. The first might surprise you. The second might make you rethink what you thought you knew. And the third, it could completely change the way you see your body and how you care for it, especially as you age. Why routine ejaculation matters more than you think. Let me explain. The prostate produces and stores fluid daily, whether you're aware of it or not. This fluid needs to be released regularly. Otherwise, it builds up, causing the gland to become congested, swollen, or inflamed. Imagine a garden hose left untouched for months. Water inside becomes stagnant, pressure builds, and when you finally turn it on, it sputters or clogs. The prostate works in much the same way. Without regular flushing, the system struggles. From clinical experience, 2 patients, 2 very different outcomes. I once treated a 65-year-old businessman who had for years avoided anything related to self-pleasure. Why? Cultural taboos, religious guilt, a belief that at his age such things were no longer appropriate. The result: severe fluid buildup in his prostate, urinary problems so significant they disrupted his daily life, chronic discomfort that made sitting for long periods unbearable. And all of it, yes, all could have been prevented with simple, consistent self-care. Now contrast that with another patient, age 70. This man had a habit of masturbating 3 times per week, nothing extreme. He didn't use any medications, didn't follow a special diet. Yet when we looked at his prostate health markers, they were nearly identical to a 40-year-old man. Clear flow, normal hormone levels, minimal inflammation. He reported strong energy, good sleep, and no urinary problems at all. The difference between these 2 men? Awareness, consistency, confidence in taking control of their bodies. Key takeaway: your prostate needs regular ejaculation to stay healthy. When you ejaculate through sex or masturbation, your prostate doesn't just release fluid, it also triggers a temporary drop in dihydrotestosterone, or DHT, a hormone essential for male development, but one that can become dangerous in excess. Why DHT matters: too much of a good thing can be harmful. DHT helps regulate male characteristics like body hair, deep voice, and muscle mass. But when it stays elevated for too long, especially in the prostate, it can cause tissue overgrowth, lead to prostate enlargement (BPH), increase risk of prostatitis and discomfort during urination. Regular ejaculation helps lower DHT temporarily, giving the prostate time to recover and maintain its natural balance. This isn't about indulgence, it's about maintenance. Think of masturbation not as a luxury or taboo, but as preventive maintenance. Just like brushing your teeth prevents gum disease, stretching keeps your joints flexible, regular flushing keeps your pipes clean. Routine ejaculation helps your prostate function smoothly. And for many men over 50, this one simple act can reduce pressure, improve urinary flow, ease inflammation, and even support hormonal balance and mental clarity. What this means for you and why it matters, whether you're 45, 55, or 75. Your body is still listening, still responding, still adapting. And when you treat it with knowledge, respect, and consistency, it rewards you with energy, vitality, and independence. So if you've ever felt sluggish, foggy-headed, or frustrated with changing urinary or sexual health, it's time to ask yourself, is my prostate getting the regular support it needs? Final thought, plus CTA for life. After 60 today, this isn't about shame. It's not about youth. It's about choosing to take care of yourself on your terms, with science, with confidence, and with clarity. Your prostate is small, but it's powerful, and what you do daily matters more than you think. Now I want to hear from you. Have you ever thought about how your habits might be affecting your prostate health? Drop your thoughts in the comments. We read everyone. Your experience might help someone else finally find the answers they need. If you found this helpful, hit that like button to help this message reach more men over 45. And don't forget to subscribe to Life After 60 today. And turn on notifications so you never miss a video that helps you stay stronger, healthier, and more empowered with age. Because the journey to better health isn't about going back. It's about moving forward. Smarter, stronger, wiser. I'll see you in the next video. Take care and take charge. We just uncovered how regular ejaculation supports hormonal balance, specifically by lowering DHT levels, which helps protect the prostate from enlargement. But that's only part of the story. Let's go deeper into the physiological and practical effects of consistent self-care, especially as men move through their 40s, 50s, and beyond. Regular ejaculation gives your prostate a break from hormonal stress. Dihydrotestosterone (DHT) is a powerful male hormone. While it plays a necessary role in male development, high and sustained levels of DHT, especially in later years, have been strongly linked to benign prostatic hyperplasia (BPH), or prostate enlargement. During ejaculation, DHT levels temporarily drop, giving the prostate a much-needed hormonal vacation, a natural break from the constant hormonal stimulation that can lead to tissue overgrowth and inflammation. And this hormonal reset isn't just theoretical. A tale of two brothers, same age, completely different outcomes. I once treated two brothers in their 50s. Both were in good shape, worked similar jobs, and had no major health conditions. But there was one key difference. One brother maintained a regular routine of self-stimulation. The other believed it was inappropriate at his age. The result: the brother who engaged in consistent self-care had significantly lower PSA levels, prostate-specific antigen, a key marker of prostate inflammation. He also reported fewer urinary symptoms, better sleep, and more confidence in his overall well-being. Meanwhile, his brother began experiencing hesitant or weak urine flow, nighttime urination, and increased discomfort, classic early signs of BPH. This wasn't coincidence. It was biology at work. Prostate maintenance. It's like changing your oil. Ignore it too long and it breaks down. Here's a metaphor I often use with patients. Think of your prostate like the engine of your car. Would you ever go 10,000 miles without changing your oil? Of course not, because even if the car seems fine, dirty oil builds up, parts wear down, and eventually performance suffers. Your prostate works the same way. Each ejaculation triggers a mechanical reset. Muscular contractions act like a pressure washer, clearing built-up fluid and debris. Fresh blood flows in, delivering oxygen and nutrients. The gland releases clean, nutrient-rich secretions, promoting long-term vitality. The longer you go without flushing the system, the more congestion and damage builds. Many men over 50 mistakenly believe their bodies are too old for regular self-care. They fear judgment, cultural taboos, or just assume it's no longer necessary. But in reality, the older you are, the more important regular self-care becomes. This isn't about indulgence. It's about basic biological maintenance. Clinical proof, even in your 70s, your body can still thrive with the right routine. One of my patients, a 70-year-old retiree, had prostate health markers better than men in their 40s. Why? Because he maintained a simple, consistent self-care routine 3 times per week. No extreme measures, just consistency and self-awareness. He reported better urinary flow, fewer nighttime interruptions, lower stress, and an overall sense of confidence and well-being. What's the ideal frequency? Here's what I recommend by age in your 40s. Aim for 3 to 4 sessions per week. This is a foundational period. Building a routine now can prevent bigger problems later. In your 50s, 2 to 3 times per week is ideal. Pay attention to changes in urination, libido, or comfort. These are early warning signs. In your 60s and beyond, at least once a week is recommended. Even moderate activity can support hormonal balance, blood flow, and pelvic muscle tone. Remember, consistency is more important than intensity. One intense session once a month won't help. A steady, moderate routine is what leads to real, lasting benefits. Regular self-care doesn't just protect the prostate. It improves your entire body and mind. Beyond the obvious benefits, consistent sexual activity has been shown to improve sleep quality by reducing stress hormones and promoting relaxation. Lower cortisol levels, helping regulate blood pressure and mood. Support immune function by triggering short-term increases in key immune cells. And perhaps most importantly, boost self-esteem and emotional well-being, especially for men who feel disconnected from their bodies as they age. In other words, this is not just about sexual health, it's about total health. Pelvic muscle strength, a hidden benefit that supports urinary control and sexual function. Each ejaculation strengthens the pelvic floor muscles, a group of muscles that control bladder function, support erection quality, and reduce the risk of age-related urinary incontinence, or ED. Think of it as a built-in workout for muscles that don't get enough attention but play a huge role in your daily quality of life. What's the takeaway here? It's simple. You are never too old to care for yourself. If you're in your 40s or 50s and haven't given much thought to your prostate, now is the time to start. And if you're in your 60s or beyond, it's never too late to begin. A 65-year-old businessman I worked with once suffered from elevated PSA and frequent urination. But once he adopted a regular, moderate routine of self-care, his PSA dropped, his sleep improved, and his energy levels returned without medication, supplements, or surgery, all from one simple shift in habit. Final reflection and CTA. Life after 60. Today, gentlemen, this is about taking back control. Your prostate doesn't need pills, shame, or silence. It needs you to listen, respond, and care. Every time you show up for yourself, even in small ways, you're strengthening not just your gland, but your vitality. Now I want to hear from you. Have you ever struggled with prostate symptoms or felt confused by all the conflicting advice? Which age bracket are you in, and what's your current routine? Let me know in the comments below. I read every single one. If this video was helpful, hit the like button so YouTube shows it to more men who need this information. Subscribe to Life After 60 today. Turn on notifications so you never miss a video about how to live stronger, smarter, and more confident as you age. Because real health isn't just about what you do, it's about what you do consistently. Stay strong, stay informed, and I'll see you in the next video. Take care of yourself and of your future. We've seen how regular self-care, even just once a week, can help maintain prostate function well into your 60s, 70s, and beyond. But here's a truth that's often left out of medical discussions. Prostate health isn't just about physical maintenance. It's also an emotional journey. Don't abandon the routine. Adjust it and stay connected. Even as your body changes, your commitment to taking care of yourself should not fade. You don't have to stop, you simply need to adapt. Your energy may fluctuate, your rhythm may change, but the system, your internal foundation, still needs movement, release, and regulation. Never think you're too old for self-care. That mindset has silently done more damage than any diagnosis ever could. Let's talk about something real. The shame and silence surrounding male self-care. For many men, especially in their 50s and older, shame becomes the quiet thief of health. It whispers, "This isn't appropriate anymore. You should be past this. What if someone found out?" But here's the truth. This is not a moral issue. This is a medical one. Meet Robert, 58 years old. Successful in business, quietly struggling inside. Robert came to my office with elevated PSA levels and disrupted sleep from frequent urination. But he also carried something heavier than any physical symptom: anxiety. He had always been disciplined in work, respectful in life, and modest about personal matters. But years of internalizing guilt around self-pleasure had left him disconnected from his body and uncertain about how to move forward. We talked. We reframed his understanding, and we reminded him that self-care is natural, necessary, and a form of proactive health management. With time and guidance, Robert reestablished a routine that fit his age values and comfort level. And within months, he reported better sleep, reduced urinary discomfort, a renewed sense of confidence and calm. What does the ideal routine look like? It's not about chasing intensity. It's about consistency and presence. Based on age, here's what I recommend in your 40s, 3 to 4 times per week; in your 50s, 2 to 3 times per week; in your 60s and beyond, at least once per week. And just as important, choose a private, relaxed space. Take your time. Be gentle. Listen to your body. Support your routine with the right lifestyle pillars. Self-care doesn't exist in isolation. To get the full benefits, pair it with light daily movement or exercise. A balanced, prostate-friendly diet, plenty of water for circulation and detox, and simple stress management techniques such as walking, deep breathing, or journaling. These habits work together to create an internal environment that reduces inflammation, improves hormonal balance, and supports long-term prostate health. Your journey doesn't have to be complicated. You don't need to spend thousands on pills or procedures. You don't need to feel overwhelmed by conflicting advice. The most powerful change comes from something simple and consistent. Listening to your body, acting with intention, and showing up for yourself not once but over and over. You're not just preventing disease, you're investing in your future vitality. I'll never forget the words of a 70-year-old patient who, after learning the importance of regular self-care, looked at me and said, "I wish someone had told me this 30 years ago. It would have changed everything." Don't let that be your story. You still have time. You still have choice. Start today. Take control of your prostate health and give your future self something to be proud of. Let's talk. Your story might inspire someone else. Have you ever struggled with shame or uncertainty around self-care? Have you noticed a difference when you've maintained a routine or when you stopped? Share your experience in the comments. We read every word, and someone else might need exactly what you've learned. If this video helped you, click the like button to support this message, reaching more men over 45. Subscribe to Life After 60 today for weekly health insights grounded in honesty and compassion. Turn on notifications so you never miss a chance to learn, grow, and take back control of your health. because the best investment you'll ever make is in your own body. And it's never too late to start. Stay strong, stay grounded, and I'll see you in the next video right here on Life After 60 today.